Hi, my name is Hayley Wainwright. I'm the first author on this manuscript and has been co-authored with Dr. Heather Morris, Professor Helen Skouteris, Dr. Nick Halfpenny, Dr. Angela Melder, and Sarah Morris, who will introduce herself now.
My name is Sarah Morris, Research Fellow within the Department of Social Work at Monash University. As a researcher with a care experience, a large part of my role within this study was to analyse transition plans and explore young people's experiences of the care and transition process of leaving care.
So we conducted this study because transition planning and transition outcomes for young people in residential care are an intractable problem. There has been extensive research over decades that have identified young people who leave residential care between 16 to 18 are more likely to experience a wide range of inequitable life outcomes. For example, higher rates of homelessness and lower rates of education and employment engagement. Extensive research has also identified key components that support a successful transition from care. So things like a young person moving out of residential care and into safe and affordable housing, a young person having pro-social support networks in place, and a young person being supported to participate in education and employment pathways. Despite the research that is out there, and despite the extensive advocacy in this space, young people continue to leave residential care and experience inequitable life outcomes. We wanted to conduct a study to look at the implementation process. So despite the knowledge that is out there about what contributes to a successful transition from care and the issues that are in the system, there is very little evidence about the implementation process and how transition planning is implemented. We wanted to conduct a study to understand the implementation of transition planning in residential care. So to address this knowledge gap of a lack of research on implementation of transition planning in residential care, we conducted a mixed method study that involved a combination of a content analysis process where we looked through the transition planning documents themselves, survey administered to young people and staff, and interviews and focus groups. We spoke to residential care service provider staff and also cross-sector teams who are involved in care team meetings with young people. And the questions that this study sought to explore were who is involved in transition planning and how young people, service providers, and cross-sector staff actually conceptualize what transition planning actually is. Also, we wanted to explore how the transition planning process is implemented in residential care across various contexts.
This study highlights the importance of and the ongoing need for adequate transition planning from out-of-home care, particularly residential care, as young people with a care experience are well documented both nationally and internationally as a vulnerable group who experience poorer outcomes across multiple life domains. Young people's experiences of out-of-home care within this study varied greatly depending on placement type, with each presenting distinct strengths and challenges. Experiences within residential care were marked by an institutional, risk-averse environment with frequent staff turnover and minimal individualised care. Young people often felt unsafe, unsupported in learning life skills, and often restricted by arbitrary, procedurally orientated rules that hindered childhood experiences. Transition to independence was often experienced as abrupt and poorly prepared for, leaving many without the skills or confidence needed to adequately transition into adulthood. Overall, residential care was seen to prioritise risk management over individual development, often resulting in instability and poor preparation for adult life.
The key findings of this study provide new insight into how transition planning is operationalised in residential care, including who is involved and how it is conceptualised. One of the key findings was that there isn't a shared conceptualisation about what transition planning actually is. So for some people, it was a holistic process that involved a range of relational and developmental components that would support young people to be as ready as possible to leave residential care. For other staff, it was a more limited process where it involved referrals to external services. And for some staff, they indicated not knowing what transition planning was. So what this tells us is that if there are varied understanding about what transition planning is, and in some cases people don't know, then it's likely that young people across the board are receiving varied transition planning experiences. We also identified from young people themselves that they conceptualize transition planning as a narrower process, primarily centered on needing to leave residential care, move into a new house, and to build some of those basic life skills. So, for example, cooking and cleaning. And this narrow conceptualization really tells us or provides insight into how they come to understand what transition planning is, potentially as a result of how they've been told what transition planning actually is. We also identified that transition planning involves a wide range of roles and service systems. However, there is inconsistent agreement on who holds responsibility over the process. We also identified there is limited and inconsistent involvement of key staff, such as residential carers, who really hold that primary relationship with young people. They work within the homes that young people live and they see them every day. And they generally are the people who hold the trusting and closest relationship to young people. However, some of them didn't conceptualize themselves as being a part of the transition planning process. However, on the other hand, some of them authored the transition plans. So it really indicated there's a lack of consistency on how the roles and responsibilities are understood and operationalized in practice. We identified that young people are typically unaware that they've had a formal transition planning process. They are typically aware that they have had some conversations. So, for example, where they might like to live next, but they don't generally get a copy of their transition plan. We identified that young people's participation in transition planning is variable and often indirect. So, for example, they're not aware that there's a physical transition planning document and they rarely receive a copy of it. They may become aware that they've had conversations related to their transition planning about where they'd like to live next or any specific goals that they have. However, their voices are typically incorporated into transition planning in more indirect ways. So, for example, staff spoke about how they'll draw on the knowledge and the expertise of staff who work in the home with young people to relay that to the case managers who then develop the transition plan and identify the leaving care pathway for those young people. We found that the transition planning documentation itself isn't really seen as a useful tool by most staff. For some staff, they found it useful, but only when used as a live document and brought into care team meetings and referenced. Because the transition plan is not generally seen as a useful document that addresses all of the needs of young people, there are various bespoke checklists and tools that are being tailored across the system. And this indicates that the tool itself is not meeting the needs of either young people or staff.
Young people within residential care describe transition planning as rigid policy frameworks that prioritise chronological age over developmental readiness, which led many young people to exit care prematurely. Participants repeatedly expressed that they were unprepared emotionally, practically, and psychologically for the responsibilities of independent living. The rigid enforcement of age mandates failed to account for individual contexts and left some young people exiting care arrangements and placed into independent living as early as 16 years of age, while others were permitted to remain longer without clear rationale, contributing to perceptions of arbitrariness and inequity. A substantial gap in practical preparation for adulthood emerged across the narratives, particularly those who were in residential care settings. Participants described being under-equipped to manage everyday tasks such as cooking, budgeting, and maintaining a household. This lack of life skills education contributed directly to housing instability, with many leaving care into homelessness, precarious housing, or inappropriate placements such as shelters or unsafe share housing arrangements. In some cases, youth were moved out of care before appropriate housing was secured, exacerbating their vulnerability.
So we identified a range of recommendations to shape policy and practice changes. So, for example, one of the key recommendations is to clearly define and communicate the planning responsibilities across services and sectors. So there is a really shared and clear understanding about who should be taking the lead, who should be supporting, and how services should be working in collaboration with one another. We also recommend redesigning the transition plan documentation, so there isn't a need for the bespoke checklists and documents that have been developed to fill the gap of what the transition plan can't do. We also recommend identifying strategies to increase young people's awareness of the transition planning process and awareness that they have a transition plan document to help guide their transition from care. We also recommend developing a clearly articulated conceptualization about what transition planning is and what should be delivered to all young people in practice. This would also involve delivering training and ongoing capability strategies to support all staff members across the system to understand what transition planning is and what they need to be delivering to all young people who they work with.
So, what does this mean for practice and policy? First, it makes clear that poor outcomes for young people are really the result of the individual failure. They are far more often the product of systemic dysfunction. Young people in our study were acutely aware of cost-cutting measures, rigid eligibility criteria, fragmented bureaucratic processes, and inconsistent service delivery as drivers of their marginalisation. Second, we found that planning tools were used inconsistently. This not only created variability in practice, but also restricted young people's opportunities to have genuine voice in their own transition planning. For planning to be meaningful, it needs to start with the young people's goals, relationships, and developmental readiness, not systems timelines or administrative requirements. Taken together, these findings highlight the need to reframe accountability. At present, accountability is too often measured by whether a young person demonstrates resilience or compliance. Instead, accountability should be about whether our service systems are adequate, responsive, and capable of supporting young people into adulthood.
So what's next? Based on this study, we also identified a need to further understand the implementation of transition planning in residential care. So, for example, a need to understand what is actually delivered to young people and which of the key components, such as education, employment engagement, and housing, are delivered to young people in practice, and what are the barriers and enablers to all young people receiving those core components that are theorized to enable a successful transition from care. We really hope that people in positions of influence and power read this publication, share it widely, and use it as a tool for advocacy for change within your institutions and organisations. Transition planning truly is a whole of government and whole of community responsibility to get right. So we hope that this reaches people in government, people in out-of-home care services, people in education, and people in other service systems such as disability and justice.